We are better together. No one can make you feel inferior without your consent. So stand up tall and know your worth. Let your heart represent. Do what you feel in your heart to be right, even when they criticize. You know the truth that lives within you, so hold your head up high. They'll talk if you do, they'll talk if you don't. They'll tell you that you can, then swear that you won't. You'll be damned if you do, and damned if you don't. So live the life that's yours to live and let them say what they want. We are better together. We are a new family, together on YouTube. Subscribe and sharing our opinions, sharing our lives and truth. Through thick and thin, we support each other. Through laughter, tears and pain, we may come from different places, but together we remain. We are better together. Some days we agree with each other, some days we see things differently. But friendship doesn't mean we have to think the same on everything. We share our story, share our laughter. Sometimes we share our tears. And when one of us is struggling, the rest of us are here. We are better together. I may not be better than someone else, but no one is better than me. We all have a voice, we all have a story, and we all deserve to be free. I won't look down on another soul, and I won't let them look down on me. I may not be better than someone else, but no one is better than me. We are better together. Do what you know when your heart is right, even when the whole world disagrees. Yesterday taught us where we've been, tomorrow is ours to see. We're sharing our lives, we're sharing our truth, supporting each other in all that we do. Through thick and thin, wherever we may be, no one is better than you. No one is better than me. We are better together.
Hi, everyone. Thanks for joining us. I'm sure more people will be coming in as they get the notifications. Hey, Melly. Hey, Finn. Hey, Catherine. Good to see you. So I know we always do Nancy Guthrie, but I'm going to be bringing my niece Jackie on. She convinced me to do the Clancy case. When we first talked about it, I said absolutely not. I never wanted to cover cases about children being hurt and unalived. But when I looked into it, I thought she can do the case portion of it and I can do the medical portion of it, since I am a nurse and I deal with a lot of patients with psychiatric issues. So not to disappoint, I made a PowerPoint presentation. It just helps me stay grounded and helps me go through each point without forgetting what I was going to say. But, we'll go through that in just a little bit. I'm going to bring Jackie on the stage. Hey, Catherine. Hi, Jackie.
Hi. I was reading the chat. I don't have my glasses on, so it's real close. Hi, everybody.
Can you hear me okay?
Yeah, can you hear me?
Yeah, I can.
Great. Longtime fan, first time guest. Glad to be here. I've always wanted to say that.
Oh, you guys are going to enjoy her. She's going to bring out the true spunk in me. I'm kind of serious when I'm on my lives and I do my videos. I'm in teacher mode, but tonight you're going to get to see the auntie in me.
Oh, and hi there. Oh, look, I got a hello.
Jackie's more than just my niece. She's my best friend. She's like a daughter, more like, like a little sister to me. So we've been close for a very long time. Matter of fact, she was born on the day that I was in the hospital with a kidney infection in the same hospital. Your dad had to bring me a videotape because they wouldn't let me off the unit. So I got to meet her the next day.
41 years later, he still can't get enough of me.
Here we go. Yay us.
Yay us. Yay us.
So this case is disturbing. I'm going to forewarn everyone. If you have a weak constitution, please leave now. This is for educational purposes only. Some of the stuff that we're going to talk about is speculation. The stuff that I'm going to present is medical information that I found on the internet that you can research on your own. And lights, camera, action, PowerPoint, yay!
Yay!
So this is the Nancy Clancy case.
Lindsay.
Brief background is that she was a former labor and delivery nurse in Duxbury, Massachusetts. She was accused of unaliving her 3 children on January 24th, 2023. So 3.5 years ago, I didn't even hear this case. I mean, it's just been recent because of the trial that I've actually heard what's going on. So her children were 5, 3, and 8 months old. Now, the prosecutor alleges that she strangled her children with exercise bands in the home, and then she attempted suicide by slitting her wrists and her neck and jumping out the second-story window. She is now currently paralyzed from the waist down. So the actual charges are multiple counts of murder and related offenses in connection with the deaths of her children. She has pled not guilty by reason of insanity, and that is going to be an interesting topic for us to discuss, because I'll give you my personal opinion. I think anybody who unalives someone else is mentally ill or pure evil if they harm a child. So, I mean, what are we going to do? Open up the prisons because everybody is mentally ill? Oh, Catherine, that's my niece, Jackie. I'm introducing her for the first time. If it goes well, we may do a weekly crime story hour with Dom C and Jackie. She knows a lot about a lot of cases that she's enlightening me about. So we're having some fun. So the defense is arguing that she suffered from postpartum psychosis, which is a very rare and severe mental illness that occurs after childbirth.
What did they say? It's like less than 1% of the...
I have it in a later slide.
Oh, sorry.
1 to 2 out of every 1,000 births can have some type of postpartum psychosis, but unaliving your children is to the far extreme. What did you say the percentage was?
Wasn't it like 1%? 1% actually has postpartum psychosis?
I believe that. Because people do go through depressions because the hormones change and everything. But
well, and there's a gradient, right? Because you have the baby blues, then you have postpartum, and then it, very rarely, but in the most severe cases, goes into this.
Correct. So they're saying that her condition got worse because of the psychiatric medications and treatments that she received. The defense also maintains that she lacks criminal responsibility at the time of the crime. I'm going to call bullshit on that, but that's just me personally. We'll talk about that later. So the prosecution, though, is saying that they believe she was aware of her actions and is legally responsible for them. They suggest that the unaliving was planned and deliberate. There's witness that testified that she appeared normal and coherent the day of the crime, and they present diary entries and other evidence to challenge the claim that she was psychotic at the time of the crime. So what is postpartum psychosis? It's rare but serious psychiatric emergency that suddenly begins within the first days to 2 weeks after childbirth. They say, though it can occur later. I mean, her baby was 8 months old. So either she was dealing with this psychosis from the first couple weeks, and then it just escalated because of all the medications that they were compounding on top of the issue. We'll see. Hey, V. Yeah, I'll click on everyone's questions as soon as we get through a couple slides. So it affects about 1 to 2 out of every 1,000 births. They're saying that the exact cause is not fully understood because it's a psychiatric condition. But it is thought to result from a combination of factors: hormonal changes, genetic predisposition, underlying bipolar disorder, sleep deprivation, brain chemistry, immune and inflammatory changes, severe confusion or disorientation, delusions, hallucinations, paranoid or extreme suspiciousness. These are all the signs and symptoms. Mania and unusually elevated mood, severe agitation or restlessness, very little to no sleep, rapid mood swings, disorganized speech and behavior, loss of touch with reality, unusual behavior towards the baby. And it says that the thoughts or commands involving suicide or harming the baby can occur in severe cases.
And this is all within the first 1 to 2 days, you said that would come up?
Days to weeks.
Days to
yes.
weeks, but first 1 to 2, right?
Right.
Okay.
Right. And before I go through the medications, I'll tell you, from my experience as a hospital nurse, I'm a medical nurse, but we do receive a lot of patients that have psychiatric issues. We joke around sometimes on the unit and we say, everyone has a psych issue. It just depends on how severe it is. So we get people who detox from drugs and alcohol. Alcohol withdrawals can be very bad. And people will go through a lot of these symptoms, delusions, hallucinations, paranoia. Some of them become manic. I've had to throw away a couple pairs of shoes with different patients, peeing on them because they thought they were standing at a urinal. And no, it was my shoes that were the urinal. Agitation and restlessness. So yeah, a lot of these signs and symptoms also are from withdrawals and from other psychiatric conditions that we have in the hospital. We have people with severe bipolar disorder. We have people who have schizophrenia. We have people, I had in all my years, only one patient with a true diagnosis of multiple personality disorder. And it was fascinating, the different voices and the different people that were inside this person's head. And I actually got to speak to 3 of the personalities because 2 of them were afraid of me. So I was able to help.
That tracks.
Yeah, I was able to help her reduce her self-harm because the 2 voices that were telling her to harm herself were afraid of me. So we had a good shift that night because, I updid my mom voice and said, that's enough. No more hurting. So yeah, mental illness is a serious condition. There are many serious conditions with mental illness, not just obsessive compulsive disorder and Asperger's and
not just the Hollywood stuff, right?
I mean, yeah. So according to the internet, she had 30 prescriptions involving 13 different psychiatric medications in the months before the deaths of her children. You can read them there. Zoloft, Ativan, Valium, Seroquel, Lamictal, Remeron, Trazodone. I've used all of these medications in the hospital setting. Not me. I haven't taken them. I've given these medications.
I had a couple questions. I wasn't judging, but there were a few on there that I had some questions about.
Jackie, your aunt did not tell you about all the meds that she's on. No, I'm kidding.
Just 2 or 3 that I was just curious about, that's all.
So the toxicology that they did when she got to the hospital after they found her on the outside was the Remeron, the Lamictal, the Trazodone, and the Seroquel. And then, So common treatments, often people are hospitalized when they have the postpartum psychosis. They get on antipsychotic medications, they get on mood stabilizers, and they get on benzodiazepams. The reason why I'm whipping through the slides, Jackie, is I'm going to do like a little infomercial and read the slides, but I don't want to do that now because it's boring. So common treatments are restorative sleep. They'll do the electroconvulsion therapy, shock therapy is what they used to call it in the 60s and the 70s.
Does
Psychological and family support. Yeah, it does work sometimes. It realigns the brain waves. We don't do it in our hospital. You've got to go to Portland for that. And then long-term prevention would be, psychiatric follow-up, going to therapy sessions, counseling, having your family watch you 24/7.
What would help if she had effective counseling services?
So
We'll get there.
Yeah. So SSRIs, big controversy with them. I don't have any issues with them because I've seen the benefits that they've had on a lot of my patients. So, what SSRIs do, they're a selective serotonin reuptake inhibitor. So, our brain makes serotonin. That's what helps us sleep. That's why you take melatonin, because it helps promote the serotonin in your brain to help you sleep. So, it's a messenger that helps regulate mood, anxiety, sleep, appetite. And it takes about 2 to 6 weeks for full effectiveness. Some side effects can be nausea, diarrhea, trouble sleeping, headaches, restlessness, tremors, emotional numbness, or feeling less emotional. So she was on the Zoloft, which I took right after Grandpa died. I took it for 2 years because I developed narcolepsy. I
Oh
was
wow.
falling asleep all the time because my brain was shutting down from the severe depression. And it made me feel a little numb, like they say, less emotional, a little emotionally numb. But I was able to stay awake during my job and I was able to function. But once the depression subsided, I was able to taper off and come off of it.
I have to say the Zoloft for anxiety is a
Yeah,
you
it's not
know.
a bad medication. So
However,
benzos, we give benzos in the hospital. We try not to in the elderly because it can exacerbate dementia. But the benzos are medications that slow down the activity of the brain and the nervous system. Kind of, it's like the brain's brake pedal. So um, she was on lorazepam and diazepam. So we call diazepam Prince Valium in the hospital because when we've got people detoxing from alcohol, they get real rambunctious. And oh, we give them a little Prince Valium and they relax and then they go to sleep. And then they feel better when they wake up. So nurses love giving Valium. And it's safe in the hospital setting. Antipsychotics, what they do is they block dopamine receptors. They control the signal volumes in the brain. She was on Seroquel. We do give Seroquel and Risperidol a lot. Oh, and Zyprexa to our dementia patients. Abilify is more for our psychiatric patients. Geodone, I wish they would use on every elderly dementia patient. I don't know why we don't. I think it's very expensive. At my first hospital, we gave Geodone a lot, and it really was a good mood stabilizer for dementia patients. It kind of helped offset what we call sundowning. In the
yeah,
evenings, they'd start to get more confused and more rambunctious, and the Geodone kind of just was like having a little nip at night.
that's a shame that that's not more widely used.
I know, honey.
Seems like it would be helpful across the board.
Listen, it's all about money in the healthcare.
True.
So she was taking. So the Remron is a antidepressant as well. It's used for major depressive disorder. Works on norepinephrine and serotonin. I'll do that in my PowerPoint presentation. I'll make that tomorrow. And then Lamictal is interesting because it's an anti-seizure medication, mood stabilizer. But we've also used Lamictal for people who have vertigo. So some of these have black label uses. So they're prescribed for a specific thing, but the black label says, well, yeah, you can also use this for vertigo. So we've had patients on Lamictal for that. So starting in September 12th of 2020 was when she started being prescribed the whole slew of medications.
My goodness. Look at how
I know,
quickly it changed.
just so many, so many, so many.
My goodness.
And then the biggest practical concern was that she was on Remeron, Trazodone, and Seroquel together, which all cause sedation. So someone taking all three of those will have significant sleepiness, slowed thinking, dizziness, impaired coordination, and difficulty functioning normally. So I don't understand how people didn't notice that, or maybe they did notice. You'll talk about that in a little bit, what her mood was. Because people's fall risk increases. Trazodone, we only give at night, and we use it just for sleep. Nunna's on Trazodone because it helps mood stabilize her, but they only give it to her at night as well for sleep.
Well, it's so
So
interesting. for this, they said that she wasn't sleeping. So that's probably why they were giving it and giving even the cocktail, not as a sedation, but if she wasn't falling asleep, just to try to
Right.
bring it down to get her to a restful state.
Right. So additional considerations is trazodone and Seroquel can both contribute to low blood pressure when standing, which we call orthostatic hypotension. You'll have a normal blood pressure when you're laying down. You sit up, your blood pressure goes down a little bit. You stand up, your blood pressure really drops, and then you drop.
That's what happened to me, remember?
Yeah, it's a serious condition.
It's so scary.
So then Remeron and trazodone both affect the serotonin system. Lamictal is somewhat different, though. In general, isn't strongly sedating and works in reducing the excitability signals in the nervous system. The side effect of Lamictal, though, is a rash. We've had people who develop this Stevens-Johnson syndrome. It's a fancy name for a red skin rash.
That is a fancy name for it.
Why might someone receive all four of these? Depending on the person's condition, the psychiatrist may be targeting several different symptoms. For example, to do the mood stabilizing, they'll do the Lamictal. For the depression, they'll do the Remeron. For sleep, they'll do the trazodone. For the bipolar and depressive or psychotic symptoms, they'll do the Seroquel. That doesn't necessarily mean all four are being used for those exact reasons in a particular person. I mean, each of these medications vary from person to person. And that's why, like when someone's hospitalized for an episode, a crisis, the psychiatric doctors will try something for a week. Sometimes we have patients for a month or so and it's not working. So they'll stop that medication and then they try something else until they get the right combination to stabilize the patient. They're hospitalized. Then when they've gone a full week of being stabilized on these medications, then we discharge them to a group home or an adult family home or inpatient psych or home with their families. So we're very diligent at my hospital system about this type of treatment.
It almost seems like with her, they just kind of kept throwing it at her to see what would stick. And
right.
I don't know.
So the key points in the trial, the jurors heard the husband's 911 call, which I looked everywhere. They're not releasing it.
No, the judge put an order on that. He had Patrick leave the courtroom when the 911 call was played. And he also had like a gag order completely on the 911 call. And for those members of the media that were inside of the room, he also wasn't allowing them to recreate or reproduce it in any way, shape, or form. I'm going to tell you, that's a call that I never, ever think I want to hear, even if it was released. Like, I don't think I could ever stomach hearing that.
V had a good question, Jackie. For those of you new to come in, Jackie is my niece from New York. She is beyond a true crime junkie. So that's why I was grateful that she wanted to come on with us tonight. So V asked, postpartum psychosis and postpartum depression are different. Yes, they are absolutely different. Depression is a normal process of a woman's hormones reestablishing back to normal with the estrogen levels, and they call it the baby blues. Psychosis is what they're claiming Lindsay had after having her baby, and it's not in the DMS, but it's considered a psychiatric emergency when you go into the psychosis phase. Jackie doesn't have a page. She's
not yet.
Not yet. She's doing this with me, and we're going to try and do a weekly on different cases because she's very knowledgeable. I mean, I'm going to keep doing Nancy Guthrie as new things come up, and maybe next week I'll educate you about Nancy Guthrie.
I'd love that.
V also said, I heard can present up to a year after. I'm not a medical professional, though. I think psychosis is a different thing.
Yeah, I heard the same thing.
Yeah, depression can come at any time. I mean, depending on your hormone balances, some people have to take an antidepressant after pregnancy. Some people have to go on hormone therapy. I mean, It depends on your blood work. It depends on your chemistry, and it depends on whether you have good doctors who are monitoring you closely. I'm just going through the chat real quick. You can talk, Jackie, in the meantime.
Oh, me? Okay.
Yeah.
So do you want me to go through the case for anybody that doesn't know? Do you know? I mean, I know you did some research.
No, I barely know anything. This is what I know, what I pulled up. The
All
jury visited the home. Testimony included forensic evidence, medical records, psychiatric evaluation, and her personal journals. The significance of the case is national attention because it centers on the legal impact of postpartum psychosis and mental illness in criminal cases. The verdict may influence future discussions about postpartum mental health and hopefully bring some type of awareness.
I hope
And then
it does.
I just went through the theories, but I can take this off for right now and you can tell us about the case.
Hello. I liked it when it was up there. This is a whole lot of Jackie.
Oh, do you want me to?
No, it's okay. It's okay. It's okay. It's all right. I'm good. So, I mean, I'm sure everybody knows, but just a quick brief for those of you that don't. Lindsay Clancy is on trial for it's YouTube, right? So I have to watch what I say. The unaliving. That's what I say, right?
Unaliving, yes.
Unaliving. Here we go. Lindsay Clancy is on trial for the unaliving of her 3 children, which occurred January 24th, 2023. It was for the strangulation. Am I allowed to say that? Of her 3 children, 5-year-old Cora, 3-year-old Dawson, and 8-month-old Callan. Following the incident, she attempted to unalive herself by jumping from a 2nd-story window, which left her paralyzed from the waist down. Clancy is a former labor and delivery nurse of 8 years. And that's kind of important when you look at all the things that have been searched and when you get into the nuances of what's happened in the day-to-day. So just keep that in your head. She's pled not guilty by reason of insanity, with her defense arguing that she was suffering from postpartum psychosis. So the biggest takeaway is that no one is arguing, or she wasn't arguing, that she didn't do it. It was arguing what her mental state and status was at the time of the killings. So the morning of January 24th, 2023, according to all reports, began like many others, where Lindsay took her daughter to a doctor's appointment for a routine physical. There, she spoke to multiple staff members. She had normal interactions and was, for all accounts from everyone who had contacted her that day, have been in contact with her, it was a normal checkup, and she seemed like she was in good spirits. Even Patrick said that this was one of her best days. So during this whole thing, after the visit, Lindsay had sent pictures of Cora and Dawson playing and building snowmen to Patrick. So all in all, it seemed like a really normal day just in their household, right? And everything just seemed great. And then Lindsay sent a text to Patrick asking him if he wanted to get takeout from a restaurant. And now we're discussing the rest, right? So I guess we'll hit timeline while we do this and just kind of go right into that. So just going over the timeline, at 4:53, Lindsay sent a text to Patrick asking him if he wanted to get takeout from 3V Restaurant, which was a place that they went to in Plymouth. From my research, they went there 3 times. As a family, they've never gotten takeout from there before, but, doesn't really matter. If you like it, you can get takeout from wherever you want. At 5:15, Patrick left the house to get in his car to get the food and children's medication from CVS. Now, there's a little asterisk in here because at 5:24, there was an email that was sent. There's a little bit of controversy of where the email was sent, of whether that email was sent from Patrick's cell phone, which would put him outside of the home, or Patrick's Surface Pro, which would put him inside of the home. That email was sent at 5:24. When Patrick was on the stand, he did not remember when or where that, not when, but where that email was sent from. So that's just something important to put in there. At 5:32, surveillance showed Patrick arriving at the Kingston CVS. At 5:34, Patrick and Lindsay had a 14-second phone call about medication. Between 5:45 and 6 o'clock, Patrick picked up the food from the restaurant and drove back home. And between 6 and 6:10 is when Patrick came home and said that he found Lindsay on the ground outside. At 6:10, we know that is when I'm sorry, 611 was when the 911 call came through. There was a little bit of a discrepancy where Patrick had said that he tried to call 911 and it wasn't going through because his Wi-Fi was down. He said that he thought about yelling out to the neighbors, but before he did that, his Wi-Fi started to work and he was able to call out to 911.
It's a crazy case.
It's a crazy case. It's a crazy, crazy case.
V brings up a good point. I love you, V. She said Andrea Yates got not guilty by reason of insanity, postpartum psychosis too, I think. And
Yes.
her youngest was 7 months. She's been locked up in a hospital ever since.
She has. And you know what? Andrea Yates, actually, every time she comes up for parole or parole comes up for her, she denies going to the hearings herself. So Andrea Yates really was that was a really crazy story too. I mean, the whole backstory of the home and the condition of the home and so many things that were missed in that case. But that was really the one real case of postpartum psychosis that we've seen. You know, unfortunately, we have seen mothers unaliving their children in the past, but this is.
And she took full ownership of it too.
Did she though? Did she take full ownership of it? She did, right? But did she take full ownership of it because, and this is where the conspiracy theories come in, did she take full ownership of it because she knows that she did it? Or did she take full ownership of it because she was told that she did it?
Which
right?
one?
So,
Oh, you're talking about Clancy.
Yes.
Yeah, I was talking about Yates. Yates took full ownership. That's
Yates took full ownership of it. Yes.
Yeah.
Yes. Took full ownership of the voices. But there was also a very devout and crazy religious aspect to it. There was a lot that went into the Andrea Yates case too.
Right.
And she was very educated as well, which was wild. Her and Rusty, her husband, were both very well educated. So it was really surprising. But even in that, you know, that's just another cry for women's mental health, because even she was crying out at that time for help.
I remember that. I remember that case.
Yeah. And I mean, this is heartbreaking. I mean, the children were beautiful children. It was a beautiful family, but it just, it doesn't feel right. Right. And there's, and I hope I'm wrong. And there's so many.
I have to tell you, the last 3 night shifts that I've worked, I've mentioned it to every single nurse that I worked with and came up. And matter of fact, we had overflow of mother baby. It's a whole nother story. But if they were like, no, she did not do it. She was set up by the husband. I mean, there's all sorts of theories. Only one nurse out of like the 12 that I asked said, I think she did it, but I think her husband pushed her into it. The other 11 nurses were like, she absolutely didn't do it.
Because it doesn't make sense. There are so many things that don't make sense, right? And like,
well, tell me, what do you think doesn't make sense?
All of it. All of it. All of it. And I know we can't just say all of it, right? But, you know, like, let's dissect it, right? Do we?
Well, I'll give you a conspiracy theory.
How was there no? Go ahead.
My conspiracy theory is she did it, and she knew she did it because her husband had a mistress and he was going to leave her, and she wasn't about to kill herself without, or unaliving herself without taking the kids with her, just to stick it to him. That's speculation. I have no idea if that's true, but that's going to be one of the theories that, oh yeah, she knew what she was doing. And maybe it was a psychotic break, but she did it. She tried to unalive herself, didn't work. And here we are today.
Is that your take, or is that just a take?
A take.
Oh, okay. I thought that was your take.
No, take.
I had a lot of challenges. So you know, listen.
You can't
the converse to that is the husband was having an affair, right? And Lindsay was never supposed to survive. And there's so many things that.
You want me to bring up the picture?
Oh my gosh. Yes. Can we bring up the picture? For those of you that have not seen the new wife, the left is Lindsay Clancy and the right is the new Mrs. Clancy.
This is
And
insane. I thought it was the same person with and without makeup, but it's not.
so there's
The blurry one is Lindsay. The clear one is the new wife.
Is the new wife, who is a doctor. She's a doctor as well. So
insane.
Just while we have this picture up, I'm going to talk about the worst of the conspiracy theories. And I hate this one. I hate this one, but I'm going to throw it out there. And I'm going to throw it out there first because I hate it so much. But there was a statement that Lindsay had made somewhere along the line. And she said that, or somebody had said that she watched herself do it. So one of the conspiracy theories I heard was that the new wife came in and Lindsay watched her unalive the children. I don't think that happened. I don't believe that conspiracy theory, but it is one. And with the side-by-side picture, someone in psychosis could very well, think that's them. And to take it a step further, I actually heard a little bit of an extrapolation on that theory, that going into the CVS, it wasn't actually Patrick. It was Patrick's best friend that went into the CVS, because the best friend had straight hair while Patrick had curlier hair. So you could tell that they were different people, or I'm sorry, into 3V. So you could tell that they were different people entering there because there was the shoe discrepancy.
Oh my gosh.
The shoe wear that Patrick was wearing in the footage for CVS. It appeared as though he was wearing like a bluish color sneaker. And in the footage for 3V, it appeared as though it was a dress sneaker. And when he was on the stand, he referred to his footwear as boots. So, I mean, listen, if that's it, that is from the deepest depths of the reaches of and a combination of every mystery thriller you could have ever read put
but that's
together.
What we love. We love conspiracy theories.
We do love a good conspiracy theory.
And we love all the little nuances that it's like, wait a minute, that doesn't make any sense.
But there's so much that points to he
like, what about the knots in the rubber band?
So let's talk about the knots.
Right?
Let's talk about the knots.
That's what the girls at work brought up.
Let's talk about the knots because she's a nurse, right? How good are your knots? You're a nurse. How good are your knots?
They suck.
Great.
I do a regular, just a regular,
Yeah.
knot. If I have to tie something, we rarely tie anything.
So
we take Coban, we strap the shit down of everything.
He sails. He sails. Do you know what one of the biggest things you need to learn and know really, really well in sailing is? I don't know a lot about sailing, but you know what I know sailors need to know? How to make a good knot.
Yep.
How to make different knots and how to make, all those wonky knots. Like the knot that I don't know what it's called and I should have looked it up, but I didn't. But the knot that looks like a tied shoelace, but it's not tied all the way. That's a sailor knot. I looked it up before this. I wrote it down somewhere, but I don't know where it is. I had the name of it.
Like a box knot or something.
But it's a sailor knot, right? Like it's a sailor knot. And his prints were, and here's the thing, right? So with those type of exercise bands, I did a little bit of research and a lot of places said that it's very unlikely, it's very hard to get prints on them just because they're so stretchy. They're rubbery. But we weren't expanding these. They were ligatures, so they were going in. And I hate to be graphic, but there was no big expanse. And if it was, as Patrick said when he untied it, just as a shoelace, you're not ripping. You're just going like that. And it doesn't make sense that there wouldn't be any type of print of hers on all three of the bands. There was one that it was missing from. That doesn't make sense to me.
Right.
It doesn't make sense to me. It doesn't make sense to me that there was white bedding and that there was no splatter on the bedding. However, there was a gouge in this area. There was a gouge in these areas, but there was nothing on the white bedding. Yes, there was pooling and spotting throughout the room. I'm trying to just choose my words carefully. Pooling and spotting throughout the room, but nothing on the bed. Nothing on the bed. And with that much of a chaotic scene and all of that happening, how
Interesting.
did that bedspread stay white?
I don't know. It depends on where she did the slicing. Was it right at the window before she jumped?
And then I have one other thing, right? She journaled everything. She
Right.
kept journals of all of the things she was doing. She kept journals of her children's, whatever she needed to for them. Her daughter had bowel issues. She kept a journal for that. No note.
Good point. No suicide note?
No note. No,
Right.
no, I'm sorry. No, nothing. Someone
Great.
who's putting all of their feelings and everything out there. You're going to tell me that they did this and they jumped and there was no note. I don't believe it. I don't believe it. There's nothing in my gut that's telling me, and I could be wrong, right? But I don't think she did this. I really don't think she did this. And I think there is so much speculation there. And let's not forget, 28 days after, his whole family, well, his wife, unalived his 3 children. So pretty much he lost his whole family. He's writing a 5-star review on TripAdvisor in Costa Rica about how beautiful of a hike it is and how he was the only one there.
A month later?
28 days after the unalivings, 10 days after the burial of the children.
I mean, I understand people grieve differently, but
a well-written 5-star review on TripAdvisor of a hike in Costa Rica.
Does it prove anything? No, but it's definitely suspicious.
I don't know. I think we got to follow this one because the more you watch the trial, the day-to-day, it's just not sitting right with me. And I just have to put this out there too. The prosecutor with the bow is killing me. I can't take it. And it's so damn smug. And it's I said this to you before. It's what's the term? It's trauma baiting, right? Trauma baiting is the term. And it's wild because you can absolutely see that she's doing it for clout. She's doing it to be used in the future. You can see that she's going to be on Dateline talking about how every morning she put that bow in her hair and she thought of those kids. And every night when she took it off, she made a new pledge and a new promise. Mark my words on that one. If I'm wrong about anything else, I'm not going to be wrong about that. Yeah. That is going to be on her Dateline, her 2020. That's going to be her sob story. She's going to get a little emotional, a little choked up, maybe some verklempt.
They all do it, sis. They all do it, right?
What do you think?
I think it could be one or the other. I mean, let's face it. It has to be one or the other. Either he did it or she did it. Now, one thing that the nurses brought up that I don't know if you found in your research is that the meds were crushed.
Yes, I did. I did find that in my research.
Nurses know the only reason you crush meds is because you're going to slip them to someone, because we've got, dementia patients who, if you give them a whole pill, they'll spit it in your face. So you crush it, you put it in applesauce, and you give them a little treat. So I think 2 of the nurses were like, why were her meds crushed if they weren't slipped to her in a fashion to either overdose her or, over medicate her and
sedate her enough.
And then give her the power of suggestion and then do the act and then slit her wrist and throat and then shove her out the window. And then go to the store.
Because that's the thing, right? Like it's such a tight timeline. It's such a tight timeline.
Right.
And that's where it just doesn't, I don't know, I don't know, it doesn't hit right. And here's the thing, right? Like the ligature is different than the manual, but I don't know. It doesn't sit right. It doesn't sit right. None of it.
Discrepancies.
Yeah, none of it makes sense. And here's the thing, right? He this isn't the first time he left her alone. He didn't think she was this mentally frail. He went out on boys' trips. He went out on weekend trips. He went out to dinners. He did all that. So it's not like leaving her alone was unheard of. And even, I don't know, even bringing it back to the scene and some things that don't make sense, right? Like,
Right.
why was Dawson in his office? Why was a child in his office, right? Like, if she was going to do it.
Right, because it's in the basement.
It's in the basement. Well, all three kids were in the basement, but why his office? He's a $400,000 a year exec at Microsoft. I don't make that much money, but my office door stays locked when I'm not in it because I can't have my kids going through my files. I can't imagine what he has in his home office. So is it commonplace that they're in that office and in that office area? Because if it was so close to him being out of work, it doesn't, I don't know what the setup of their house is. It's a wonky looking Craftsman, but I don't know what the setup is. I don't know if there's a playroom area down there and if it's normal for them to be down there, but that struck me as kind of odd as well. Especially the child in his office.
And I want to clarify, we're not accusing the husband of anything. We're just doing the wild speculations like we do on every single case. She has pled guilty or not guilty by reason of insanity. According to the documents that I read, she's taken responsibility, yet nowhere could I find that she remembered the exact details of what happened.
Mm-hmm.
So that's what we're discussing is the what ifs, the extremes of conspiracy theory world.
Oh, I mean, some of them are really far out there.
Let's face it. There was that weird case of the husband and the au pair.
Oh, yeah.
Who opened up an account on this sex website and lured this poor guy to the house.
It was adult friend find. I remember that. Yeah, it was adult friend finder, and he lured the guy over and
pretending to be his wife.
Yep.
Saying, you know, be rough with me. I'll scream, but that's what
I like.
Yeah. Yeah.
That's what I like. That's what I want.
And then, you know, shot him and then unalived his wife and thought he was going to get away with it.
Yep. And then there was that man who had the thing up about his wife and let all those other men have, it was like 79 men have their way with her.
I remember that.
So listen,
that was sick.
And that's why we talk about the kind of crazy theories that are out there, right? We don't believe all of them, especially the one about the shoes and the best friend being involved and the one that's so outlandish. It's crazy.
Right.
Could he have something to do with it? Maybe. There's enough discrepancies for me to have a very big pause in this.
Right.
There's enough discrepancies for me to have pause. But some of them are absolutely wild conspiracies. And they're just...
And this isn't the trial. This is the trial to determine whether she's mentally competent, right?
This would, yeah. So not if she's mentally competent. This is the trial to determine if she was indeed, I guess, clinically, legally insane at the time of the unaliving of the children.
Okay.
So that's what this is to find out. But because there was nothing else, this is where all of this evidence is coming out. And this is really the first time anybody's hearing all of these things. And it seems like from her reactions, even the first time Lindsay is. But that's why Reddington is getting frustrated with the prosecution, right? Some of the things are overkill because for all intents and purposes, Lindsay Clancy has admitted guilt, right? So let's put that out there and let's report the accuracy of that. Lindsay Clancy did indeed admit guilt in this. What's being questioned now was her mental state.
Correct.
So, that's important to have noted as well.
And the prosecution is just saying, no, she wasn't in a psychosis, but wouldn't they have to show a motive or no?
From what I heard, I believe in the state of Massachusetts, it falls back on the prosecution. So the prosecution has to prove that she was insane. Was
not.
Right. The prosecution has the burden, where in other states, the defense has the burden. In Massachusetts, the prosecution has the burden.
Right.
So this is it's
Well,
a
and that's
really,
why they brought all those psychiatrists up.
but
The telehealth one, and I heard from one of the nurses last night too. They believe that the husband wants to blame the healthcare professionals because then there's a lawsuit down the road for that, a wrongful death of his children lawsuit at the hands of his now ex-wife, because they didn't treat her appropriately. But from what I was reading, she was on the right medications. They were trying different medications to help mitigate her symptoms.
yeah.
I mean, how can you as a physician know if someone is going to be in that 1% of developing a psychosis?
Well,
You
it would help
can't.
if you saw them in person, right? Like it would help if you saw them in person and you didn't have a 17-minute telehealth appointment with somebody who's struggling.
Yeah.
So, I mean, that there is something to be said for that too. But there was also a side argument of did she have bipolar? Was there bipolar? And there was, I forgot the name of the doctor. It was so strange because Patrick Clancy in his testimony said he never remembered this doctor and never remembered talking about this doctor. And he was actually in the appointment. The doctor had it in her notes. And this was a doctor, I believe her initials were LT. I don't remember the name.
It's okay. Yeah, it's okay.
But anyway, she had brought up the potential of Lindsay having bipolar, and Patrick's immediate response was, my wife doesn't have bipolar, and wouldn't even entertain it. So if she was taking Zoloft, which is an SSRIs and bipolar, they don't
mix.
gel, right?
Correct.
They don't mix well at all.
Correct.
So, and like some of the meds she got pulled off of very quickly. I get that, if it doesn't sit right with you, if it doesn't sit right with your stomach or your head, but there was a lot going on, and it just doesn't add up. For all accounts, everyone said she was a great and loving mother, and those diaries were just heartbreaking to hear, though. Those diary entries were heartbreaking to hear, and you can still hear that there's a mother that cares and loves in there. And I don't think that's even debated, even if this happened. It's the matter of the psychosis, but this one's just a toughie.
Yeah, for bipolar, it's a whole different listing of medications. Like the old original medication, and some people still take it as lithium.
So let me ask you, or I don't know if you would know this, what would it look like to have bipolar and postpartum psychosis? What does that look like? Like, not only what does that look like, but what is a treatment for that?
It's a good question. You would, being a nurse, I wouldn't prescribe anything, but what I would see in patients is they be prescribed the antipsychotics that we listed earlier, not the SSRIs with the bipolar disorder. Because in bipolar, let me take a look here real quick. They use mood stabilizers like lithium, Depakote, which we also use with Parkinson's patients, Seroquel, which they had her on. Abilify is used for bipolar. Yeah, I've had several patients on that. And then it says antidepressants, but it says these are used cautiously, as almost always combined with mood stabilizer and antipsychotics. Using an antidepressant by itself can trigger a manic episode. So even just Dr. Google says not to use just an antidepressant. So bipolar is it's totally different. So was she undiagnosed bipolar?
Right. Did we not get to the right diagnosis because we didn't have the right amount?
Yeah, maybe she was non-symptomatic and the hormone changes. I mean, I haven't heard anybody talk about how was she after the birth of her first child. How was she after the birth of her second child?
She did have postpartum after the second child.
There were reports of
that. Yeah.
Just depression.
Just depression. Yep. There were reports of depression after the first. It got worse after the second, and then it did go into
Yeah. And it's
this
age
was
related. Your hormones change. I mean, it's very possible she did have a psychotic break. I'm not going to say that I know, yes, she did, or no, she didn't. I can't say that.
But can it happen? I'm naive to this, right? Can it really happen that quickly? Can it
Yes.
happen
Yes.
so quickly that you send him out to get Pedialyte for your child who you're intending to unalive?
Yes, it can happen that quickly, Jackie. I
But
mean, it's
can
like a
this whole
it's
thing
like a
can this-
it's like a switch. I could be talking to a patient with a certain
that makes
mental
sense.
disorder normally, and all of a sudden, they like literally like that. That's why I never stand more than a hand's length from them, because I know better from watching other nurses get hit. You know, just split second change.
But I feel like this whole thing would have to happen so quickly from the time he left the house.
How long was he gone?
So he left the house at 5:15 and he got back between 6 and 6:10.
Not even an hour?
Not even an hour.
That's fast.
It's a tight timeline, and especially with the injury to herself.
And that's why the prosecution's saying it's premeditated, because of the type of timeline.
I don't know. It's hard. This one's a tough one. This one is for me personally. This one is a tough one, and I love me a good conspiracy theory, right? But
I'm going to put the link down and see if we've got anyone that wants to come up and talk to us about this. I know this is a tough case, and that's why I didn't do any research on it, because I do not like cases that involve. I don't like to openly discuss cases that involve children. I'll research them myself and think about it myself, but to openly discuss it in public, it makes me uncomfortable because it hurts my heart, I really, really believe that there's a very special place in hell for people who hurt children.
100%.
I mean, the worst of the worst of the worst people.
Yeah, this
Are the
one's
ones
a tough one.
who hurt children.
Yeah.
You know, unalive yourself, that's fine. I mean, it happens all the time. But when you got to touch a child, I'll pull the switch. I will pull the switch myself. Listen,
right? No, they're innocent.
I'm trained. I can administer the shot. I'll administer the shot. Thank you very much. So.
Well, you know, that was the other thing too. Did we talk about that already? The Google search? I know we talked about it offline, but did we talk about it on here?
No, you didn't. Tell me about the Google searches.
How there was Google searches about how how to unalive oneself, and where the carotid artery was. And
if she went to nursing school, she would know where the carotid artery is.
She would know. I mean, you would know that if you didn't go to nursing school, if you were just, not low level medical, but like if you were in the medical field, you know where that is.
I see you, Wayne.
What?
We're going to bring Wayne up. He is a wonderful guest on all of our channels. So, hi, Wayne.
Hi, Wayne.
What's going on?
We Investigates. This is my niece, Jackie.
Hey, Jackie. Very nice to meet you.
Hi, Wayne. Nice to meet you.
Nice to meet you, too. So glad that you're covering this case. Dom C., are you covering the trial, too?
No, I haven't. I might. Wednesday's Sunday, Monday, Tuesday. Wednesday's my first day off of a week.
Okay.
So I really want to do a deep dive before I cover the trial and any of the information that I know you're covering the trial, right?
Yes. Yeah. So whenever you're not, if anybody wants to come over, and you're more than welcome to share what I've already streamed and that kind of thing.
Oh,
too.
Excellent. Thank you.
I'm playing catch up on the case, though, to be honest.
Since you have been covering the trial, Wayne, what's your perception of what you've been hearing?
Unlike you, I didn't do my research, so I went in not knowing hardly anything, but I saw a lot of people talking about it, so I decided, you know what, let's do this. I have a daughter that has 3 of my grandbabies. She struggled a little bit, with the postpartum stuff, and having 3 kids, and Dad, what am I going to do? I can't take it. They're driving me crazy. And so I had to talk to her, hey, calm down. Everything's going to be good. You're going to miss this. They're going to be grown before you know it, that kind of thing. But I mean, she never that far out, but she struggled with it too. So it's been really interesting. I got some people in my chat that think absolutely she did it, burn her at the stake. I got some people in my chat that says, nope, 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 he did it. And he made her think she did it. And then I got some people that think both of them did this horrific deed. And I'm like,
that's a new one. I never heard that one. Both of them.
I didn't hear that one either. At work, it was the one nurse who said she did it, and 11 of them said he did it. So I did not hear that they both did it. That's bizarre.
Can I have those numbers one more time, please?
I know.
Did you just say 11 thinks he did it?
11 out of 12 nurses that I pulled at work said that the husband did it and convinced her that she did it. And only one nurse said, oh, no, she definitely did it.
Do we know what this jury looks like, what it's made up of as far as females and males and that type of thing?
Oh, that's a great question. I'll look that up now.
We're
Wait, who's been your favorite so far to take the stand? I shouldn't say favorite, right? Like, I guess that's the wrong phrase to use, but who have you found the most captivating as far as witnesses that have been brought up?
Well, it would have to be her husband, but to be honest with you, when you're live streaming the court the way I am, and you're new at it the way I am, you got a lot going on. You got a lot going on with your chat. You got a lot going on here in StreamYard. You're trying to do some different things, and you're having people call up and stuff. So you get a little bit distracted doing that, and you're not able to pay attention as close as you need to body language and that type of stuff. So I'm going to fall back some this weekend, and I'm going to start, hitting high points in there. But, the husband's testimony would have to be the most captivating up to this point, I would say.
Yeah.
I'm going to bring No Cap Ginger Snap on. This person is new to me, so we'll see what they have to say.
Okay, so
you're going to love her.
So I just while we're bringing them on, the jury composition and selection, it's an 18-person panel. It was selected from a pool of nearly 300 candidates. The breakdown is 10 women and 7 men.
10
That's
to
a
7.
big jury.
Okay. That's a big jury. Yeah.
I've never heard of that many.
Does that include the alternates, Jackie?
Yes, it does.
Okay.
And I believe with this jury, there was something that said that they didn't know who the alternates were going to be until the end when everybody got pulled.
Right.
Interesting.
Well, that's pretty normal, but that's a huge jury. That's a lot of alternate jurors there. I can promise you this. I mean, hearing you say 11-1, and they're never going to convict her. It's going to be a mistrial. At the very least, she may walk. That's crazy to me. 11-1.
It doesn't. I don't know. Do you think it adds up? Do you have, or do you not give your opinion on these cases as you're covering them?
I usually don't, and I probably won't on my channel. But I can hear. I mean, I have to say, I went in, with her admitting that she did it. I went in 100% that she did it. I've seen two guys go start with the same exact opinion as me, and I've seen them be pulled to the other side now, to where they think that he possibly did it. What he did after this, what he did, going marrying again and all that kind of thing, I can't say that shows that he's guilty. I can't do that. I can say it shows that he was a piece of crap. Maybe he was having there. That means he's a piece of crap. Maybe that messed with her mental state. Where I can get on board is, did he mess with her medication and drive her over the edge?
Right, because there was a report that there was medication.
That's what some of the nurses
that a lot of her medication was found in his truck, right?
Right. So I can get on board with something like that. He was supposed to be returning that was unused medications, that stuff she was supposed to be coming off of. He was supposed to be, returning it. You know how I'm sure you do, Dom C, as a nurse. They take it back to the pharmacy and they have a bin that they put unused medication in.
They have a disposal bin.
That's what I heard was supposed to be happening to that medication, but I don't know. And maybe was he trying to make her look crazy and try to get her admitted or something like that so he could divorce her or whatever and run off with his new girl and get custody of the kids? Maybe. And did it go too far and he messed her up so bad that she did something this horrific,
Yeah, that's why I'm saying the conspiracy theories, can be out there because it's such a heinous crime, first of all. But there are some inconsistencies in what was going on with her and what was going on with him. So that's where the conspiracy theories come out of. No
Right.
caps, Ginger Snap. Unmute yourself so we can hear you, please. Welcome and thank you for being here.
Hello, Ginger.
I'm hurt, Domsey. I've seen you in Kev's chat so many times. I thought you'd remember me at least a little bit.
Girl,
I'm not really
on
hurt.
I'm on 3 hours of sleep because I worked 3 night shifts in a row and my arthritis was bad, so I apologize.
No. I'm just kidding. I'm just thankful for letting me be here. I've got a really scratchy throat. I'm sorry if I don't sound right, but as the biggest thing, like, I have a degree in psychology, but I never actually used it in the real world, I guess we could say. But I have my own struggles with mental health and depression and anxiety. Nothing like the bipolar or any of the major things. I have a grandfather that he was schizophrenic, and that's a real. You can take medication, but it's not really gonna do a lot of help because that medication people take, it makes them feel some type of way that they don't like, and they stop taking it.
You're 100% right.
And bipolar as well. I know many people that are bipolar who have taken medication and they don't. They try to explain to me what they feel, but I don't understand it personally. But I do understand the struggles that I've been through with just, I don't want to call it simple depression or simple anxiety because it has been far from simple for me as a mother of 3 children, a single mom. And not to really, I don't want to put myself out there. It makes me sound bad, but yes, I've been a mom of 3, and no, my 3 children all have different fathers, but the one thing they had all in common was me as a mother. And the things that I have heard this so much through this whole the court hearings and all that, I've seen people's comments blaming the father, blaming the husband, and I don't know for a fact one way or the other if this man if there's evidence of this man doing the like the medications. I've missed that part of that being found on him.
Ginger, it's all speculation. The nurses
Okay,
that I work
okay.
with love conspiracy theories, and they were all just coming up with their own conspiracy theories. There's no evidence that he tampered with
Oh,
the medicine. There's no evidence that he psychologically abused her. There's no evidence of any of that I've seen anywhere on the internet. So
oh,
that's why I really clarified in the beginning, this is outlandish, out of the ballpark
right.
speculation because, we love true crime and we love crazy conspiracy theories. So
Yeah, exactly.
that's what we're
Love the
going off
conspiracy
of.
theory.
Yeah, absolutely zero
I
of
don't want
anything that I found online about him doing anything wrong.
Right. Well, I know this for a fact. I've been through hell with men in my past. At this point in my life, being 50, I'm pretty sure it's like it must be something wrong with me. When everything starts to go wrong, and I have been through literal hell with. I can't say specific whatever, but there is absolutely zero chance that any of my children I was their mom, and I was going through hell, but they didn't have to know it, and there was nobody supporting me. So it's hard for me when I saw that man get when he was on the stand. I'm an empath. Yes, I feel pain from people I don't even know. And I saw that man trying so hard not to break down. I don't know if he may have had an affair. He may have been a complete asshole. Like,
Right.
obviously, he may have done that, but that would have never, there was never any time that I got treated like crap. 1000% crap, in a good word, that I would have ever, like, put that on my kids. So as far as when people say, "Oh, he should have done this. He should have paid attention to this and that, and he should have known this and that." No, I don't care. Nobody recognized what I was feeling, nor did they care. That they did what they were gonna do, and they did it everything we can come up with at this point. They did it to me. Still, I never, ever would have taken that out on my kids. They were my children, my life. So
Right.
I don't care. I don't care what he did. If he drugged her in some way that she wasn't able to comprehend, that's a different story. But if she was just upset, it's just like when you said earlier, Domsey, that I think you called it a conspiracy. The first thought was, um, you know, maybe she did that to get back at him, kind of. Yeah, that kind of makes sense. Like, she lost her brain cells. She totally lost her mind. Ow! I'm sorry, my
Definitely ain't
dog's in
open
here.
to do that.
I'm sorry, my dog. The dog's
Oh,
so
you're
loud.
fine, buddy. Hey,
Um,
buddy.
you buddy, his buddy. He was jumping on my bed like a maniac. But yeah, there's literally zero chance that I would take the fact that he may have cheated on her, went to New York, or had an affair and he has another wife and a baby and all that. Yeah, okay, maybe that happened, but I know I'm not the only one that it's ever happened to, that is a single mom that
Right.
got treated like
Right.
crap. And
And
we didn't
sometimes
have to take it out.
people are in bad circumstances, not by any fault of their own. I mean, even if she knew that he was having an affair and maybe they were trying to work it out, or, maybe he was on his way out, doesn't excuse her actions. I think
Oh,
that is as part of it. And I understand people don't like speculation, but isn't that part of the true crime? I mean, Nancy Guthrie, there's been what, 100 different conspiracies that people have speculated. So, I mean, it's part of the true crime community. It's not saying that someone specifically did something specific. It's to brainstorm and say what else is out there, because there have been bizarre cases that it looked like a particular person did a particular thing. And in the end, when they found all the evidence, it was something completely different.
well,
So I don't mind speculation because it makes you think and say, is it plausible or is it not plausible? That's how I try and do it, the scientific method.
no,
Or
I
Occam's
agree too.
razor. Can it really happen? Is there a possibility of it happen? Like, let's say her ex-boyfriend from high school was jealous that she was married to this guy and had 3 kids. Did he sneak in the house? I mean, it's not plausible because we didn't hear about an ex-boyfriend. We didn't hear about, a situationship going on. So that would not fit into Occam's razor. But there were 2 people, 2 adults in that house. There was her and there was him that I
I,
know of.
I kind of feel like
Yeah.
I totally agree.
Yeah.
1000% agree.
I
I
wasn't
think
there, so I don't know.
me
And
neither.
Wayne has seen more of the trial. You know, I've seen, what, 2 seconds of it. Jackie, have you been watching the trial at all?
Bits and pieces. I've been working, so
I know, I've been
trying
working
to.
too.
Do you
So
mind if
You do
I
what you can when you got to work during the day, but no,
I
it's
just wanted to
definitely been,
bring something different on my channel
yeah,
for
it's
today,
been
and for
interesting.
Jackie and I to experiment with going back and forth to see
right,
if there were other cases we could explore together. Because,
right.
you know, right now there isn't a lot going on with Nancy. You know, when we're done, I'm going to play the video of JLR waiting for Juice to come out of the courtroom so
Right,
we
right.
can end on a happy note,
Absolutely.
especially with our boys. So that
Absolutely.
was the reason why we brought up this situation. So
Okay.
I
Hey,
appreciate that
just
David
so you
Snap.
know, I'm restreaming this on my channel too, by the way.
Oh
Just
yeah, no problem.
Oh,
thank
No
neat.
you.
problem at all.
And I have a question. Can I ask Jackie, can I
Yeah.
ask that timeline one more time, please? And why you think it's so constrained?
Yeah.
Because
So
I just
the
caught that when you were saying it earlier and I didn't pick up on everything.
Yeah, so it seems really tight. So just from everything that I've kind of looked at and built together, this is the timeline that I've put together through all of the sources. At 4:53, Lindsay texted Patrick asking if he wanted to get takeout from 3V. At 5:15, Patrick left the house in his car to get the food and to pick up the child's medicine. So here was my asterisk. At 5:24, an email went out from Patrick to his employees. The question is, where did that email come from? Or there is a question of where did the email come from? Because it could just establish timeline. And that email came out at 5:24, because if it was on the Surface Pro, that means he was home. If it was on his mobile, then it supports this timeline for Lindsay indeed being guilty, right?
Okay.
So at 5:32, surveillance showed Patrick arriving at the Kingston CVS. At 5:34, Patrick and Lindsay had a 14-second phone call where he called to discuss confirmation of which medicine to buy. Between 5:45 and 6 o'clock, Patrick picked up the food from the restaurant. And between 6 and 6:10, that's when Patrick arrived home, found Lindsay, and made the 911 call. That is a very tight time to commit, in my personal and humble opinion, that is a very tight time to commit 3 ligature strangulations as well as severe damage to yourself.
How much time did she theoretically have?
Less than an hour.
And
All this happened in less than an hour
to get it
from when
all
he left
done.
the house.
And I understand there's a very big difference between ligature strangulation and manual strangulation, right? With manual, it's constant pressure. With ligature, you have the knot, you walk away. I understand there's a difference, but it's just so tight.
is that the last time she had any contact, and then within an hour she committed the crime, or is
It's within less than an hour. At 5:34, they had a 14-second phone call. So that makes this timeline even tighter.
That's the last time she's shown like having a phone call, being online, or anything. So how many minutes is that? Can I ask you that?
From 5:34 to 6 o'clock, that's less than 30 minutes.
Okay,
I feel like the difference is these were little kids. These were babies. They couldn't really fight back.
it's true.
That's where I'm thinking, like, it's hard. I can't even imagine.
I know, that's why I had a
doing
hard
such a
time
thing.
covering this. I know.
Yeah, it's tough to think
know.
that
Did
way.
anybody
Yeah.
know how that phone call went? Was it like pleasant? Was she freaking out?
It was a 14. No, he said that she sounded normal. He reported this on the stand. He said that she sounded normal.
Okay.
And he said that he was asking her if he could buy the generic of the stool softener for their daughter.
Okay.
And if you look at the picture that was posted of the CVS bag, you can see that he actually wound up, if you really zoom into the picture of the CVS bag, you can see he wound up buying brand name Pedialyte for the child. And the way the kids' dishes are stacked on top of the CVS bag, which is a little questioning, but I don't know. Sometimes when I grab takeout for me and my husband, I'll grab whatever's there. And sometimes it's a kid for separation plate too. So I really don't want to read
Yeah.
too much into that. I've read a lot into a lot of things. I don't want to read too much into that.
Right.
Because he could have just went, grabbed plates, put them down, and had like a really eerie feeling, because let's face it, no matter what, there was probably a real eerie air in that house.
Yeah.
Did he arrive home in 26 minutes from the last phone call?
Yes, from 5:30 at 5:34 was that first phone call. He arrived home between 6 and 6:10. So actually that increases the timeline a little bit, right? Because that 911 call was at 6:10. So that does increase our timeline by a little bit.
Right. So she got off the phone with him and she went in the basement and then she did 1, 2, 3. And then she went upstairs and, both wrists and the neck. And then he found her.
And then
he found her in the yard, right? She jumped out the window or.
She jumped out the window.
Right.
And he found
wasn't there was one of the 3 children that got sent to the hospital, right?
Yes, the youngest one.
Right. So like it's so difficult to actually try to think this through. But I love a conspiracy as well. But as a mother, I'm sure you guys know that is just,
it's unfathomable.
Yeah.
I love debunking conspiracy theories, so I guess it's kind of the same thing. You know what I mean? I like to get in there and dig in there and find the facts and be like, nope, that's no way that happened. Nope.
I love a good conspiracy theory. I love one.
Get to the truth. You know what I mean? I like the truth. I want to see people held accountable for horrendous acts, because at the end of the day, this is a terrible, terrible thing to happen. So if she did do it, I don't want to see her walk because he was a complete asshole. You know what I mean?
Right.
If he messed with her drugs, then okay. I get that. But I mean,
did I hear you say, Domsey, that she could walk? Like,
that's what Wayne said.
I know she can't walk.
I feel that if
paralyzed,
she did it, whether it was temporary insanity or not, I mean, there has to be a sentence. I mean, I understand mental illness. I work with people who are mentally ill all the time. But here's the thing. You start a slippery slope. Someone has a psychotic break. They do something awful. It's very difficult to prove. Was it really a psychotic break? Was it not a psychotic break? I mean, you're going to open up the jails then, because anyone who kills somebody is crazy. Has some type of mental deficiency.
Right. Like that mental health
where do you
claim.
draw the line?
Right. We all have mental health
issues. If she had the psychotic break, then you put her in a psychiatric. Maybe we need to build separate psychiatric prisons so that they get the help that they need, but they're also not part of society because they committed a heinous crime.
Amen to that.
I tried once before, and that all fell apart.
Do what?
I don't know.
Yeah, I feel like we have that. We have that big Pilgrim State hospital that's completely debunked. I mean, that would be the perfect place. And
that was back in the 80s, where they deinstitutionalized psychiatric facilities because of the abuses in the 60s.
It's true. The Westbrook files.
And people we don't have a lot of privately funded psychiatric facilities because the payout from Medicaid and Medicare is only about 60%. So these facilities make no money, and a lot of them end up self-closing because they can't afford to keep them open, and the government is not subsidizing them. I mean, they are through the Medicaid and Medicare, but not to a point where a facility can pay staff and medications are expensive. And it's a big, big issue that maybe I'll do a PowerPoint presentation on that too.
I've always been that. Sane people do not unalive people. So the insanity thing, and I know it goes, that's like putting everything in one bubble or whatever, but it's true. If you got your right mind and everything, you're not just going to off somebody. You know what I mean? So you have to be a little bit cuckoo to do it in the first place. So I understand that people, like with medication and different things, you may go way deep off the end, but if you actually did it, whether somebody messed with medication or with this, that, or the other, I'm sorry, you can't walk amongst society any longer because we can't trust you out here to not take another life. That's just the way that is, in my opinion.
It's a complicated problem because some of the homeless patients that we have, they don't want to go to shelters because they feel they're in danger there because they get abused there by other homeless people. And their stuff gets stolen and gets gone through, and they can't use at certain shelters and even certain outpatient or inpatient psychiatric facilities. They, in a group home type environment, they get tested daily, urine tested daily. So they don't like those places because they can't use when they feel like it. So they end up being homeless. And then when things get bad, they come to the hospital, they have chest pain, or, they legitimately develop pneumonia from being out in the elements. And they end up staying with us for a month to 3 months because our hospital really is compassionate and finds a safe discharge. The first hospital that I worked for, they gave people bus passes and they were like, bye. You came in, you're gone. The same way you came in is the same way you're going out. Whereas my current hospital system is very caring about people in our community. So we will house them in the hospital for 2-3 months until a safe discharge. But it's a big problem because now you have then people in the emergency room waiting to get a hospital bed because they're currently sick and not awaiting placement. And we're full. So they're having to spend 30 to 90 hours in the emergency room waiting for someone else to discharge so that they can come up to the unit and have a private room. So it's a mess. When I'm queen, things will get solved. But until then, this is what we got, and we got to work with it. I mean, it's just the way it is. And it's sad. It hurts my heart.
Yeah, this was a toughie.
So any closing statements on the Yancy? I can't wait to get off this and play JLR. So, Wayne, any closing statements on this? You're muted. I can't lip read. There you go.
Sorry. Still learning as we go, y'all. Learning as we go.
I know, we're doing great.
Yep. And thanks for having me up with this case here. I'm still learning as I go. It's good to get a bunch of different perspectives. Trying to get a couple of guys to get over and watch the trial with me so I can have some different perspectives of what's going on.
That's a good idea.
Yep. So it's a very interesting trial. I look forward to watching the rest of it. Everybody, make sure you watch Dom C first if she's covering the trial live or any coverage she's got. Watch her first, please. But if you need somewhere to go to watch the trial and chat with us, please come over to my channel.
Well, if we have time, we'll dual stream, Wayne.
Hey, dual stream sounds really good too.
Yeah, absolutely.
Sounds awesome.
Ginger Snap, any final comments?
My only final comment is I'm thankful for you letting me come on and just to talk about this trial. I've seen most of it, but not all of it. So I was coming here to give perspective as a mom, as a parent, and a little bit of what I've seen as well. So thank you. I'm ready for the next topic.
Can I say one last thing?
No, you're gone. No, I'm kidding.
I missed my chance.
Gavel comes down.
C, I think you're great and you do great content. I love watching you. I love watching you and Nikki go out on the road trip. That was awesome.
Oh my gosh, what a cluster! But it was a great learning experience.
It was really cool. I watched both of you, so I could see one on my laptop. I could see one up on my television and stuff. That's kind of what I do, and I even have my phone if I want to add a third stream into the picture.
Towards the end, I realized what the feedback was. We both had our mics on.
Mm-hmm.
And so I turned my earpiece off thinking that would work, but my mic on StreamYard was on. I needed to click that off, right. And then the reverberation would have started. But you know what? It was the first road trip we've ever taken. So, and it was so beautiful out there that day. It's just, I started having anxiety with all those people, and then some jerk pushed me from behind because I stopped so that these people could take a picture, and he shoved me, and Nikki, grabbed my arm so I didn't fall. And then she wanted to kick the guy's ass. And I'm like, no, I just want to go. I just want to get out of here.
Yeah. I mean, I'm with her on that one.
Yeah. Well,
I love your background too, by the way.
Who?
Nikki's. I love your background too. That's the one more thing I wanted to say, but I wanted to make sure I gave Dom C her flowers real quick. But I wanted to say, welcome to the true crime community, Jackie. I see you got Jax. Is that what you prefer up on the screen, Jax?
Oh, Jackie's fine.
Okay. So welcome to the community, and please be a part of us. We all love each other. We support each other.
Yeah.
And you've got a wonderful. You said this is your niece, right?
That's my baby. Yeah.
What do we say, auntie or aunt, or how do we say that? Auntie?
Aunt works.
Okay. So yeah, she is wonderful. I know that you're wonderful as well. You're both very intelligent ladies, I can tell, and you're very well spoken. So it's nice to meet you, and welcome to this family, and you're going to love it here.
Oh, thank you. It was nice to meet you too. This was real fun. This was my first time, so this is something.
Right.
You peeled the Band-Aid off.
Your channel. Get your channel going so we can come over and support you as well.
I will.
Hit the like and subscribe button.
And on the notification bell too, guys.
Oh, that's right. Notification bell. That's really important too.
Okay.
All right. We'll see you in a little bit.
Thank you for having me up. I appreciate it.
Thank you for being here. As always, thank you for being here.
Thank you, Dom C.
All right.
Miss Jackie.
This was so much fun.
I'm so glad.
I enjoyed this.
I normally try not to go over 2 hours because of my voice box dysfunction.
Oh my God, it was an hour and a half.
I know. I'm trying to drink water and stuff because you know how I get, and then I start talking like that.
That's okay. I'm gonna sound Muppety soon anyway, so really we'll just balance each other out that way too. It'll be great.
Legit, for sure. And then the next case we do, non-children case, and then I'll be more into it and I'll be more enthusiastic.
Oh, what are we doing next?
Argumentative. I don't know. There's so many good cases out there.
You should ask your people if there's something that they'd like us to do next.
Okay, put it in the chat if there's any specific cases, or email me at domsea303@gmail.com. Email me any suggestions because you guys know I love to research and I love to make PowerPoints because it helps with the research, because then I can put everything systematically in my brain. But yeah, Jackie, it's going to be interesting to see. Do you know how long the case is going to go on for?
I think they said that they're wrapping it up. It should be after this week. I think it was only supposed to go 3 weeks. It could go into a fourth. But I really think it's only going to go the 3 weeks.
So we'll see if the verdict comes before I have my week off from work starting Wednesday. You and I can brainstorm and we can discuss what the verdict was and why it was what it was.
Sounds good.
Sound good?
All right, I'm here for it.
Stick around and watch JLR if you want, but I know you've got stuff to do and kids to take care of.
I have kiddos still awake downstairs, so
I love you, honey.
It was so much fun.
I'll call you tomorrow.
Bye, everybody. Thanks for tuning in.
So for those of you who didn't know, that's my niece, Jackie. She's my oldest brother's son. She's our first niece. And that's why I said, she's like a baby sister to me more than she is, my brother's daughter. I take sometimes half ownership of her. When she was little, she was the spitting image of me. So people used to think that she was my baby, and she is my baby to an extent. So thank you guys for listening to this case. I'm not going to go off now because I really wanted to share the JLR video of him with Juice. I just thought it was so sweet and so adorable because, like you, I love them all, but I especially have a special thing in my heart for Juice. He's such a sweet young man, such a good young man, and he deserved to have all the charges dropped, but he also deserved not to be arrested in the first place. So, we can talk about that once we see the video. I'll share it with you so that I can take a tinkle break and check in on my cats because they've been meowing downstairs. So I'll be back in about 3 minutes. I will share the video with you. Let's see. The Juice. There it is.
Tears of joy for the juice. It's freaking good. A huge congrats to Juice. The Army has your back. Oh, I'm so happy. Hey! Hey! Dun, 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 dun.
The only thing is they didn't do without, or they didn't do with prejudice. They did without prejudice. So I gotta get that sorted out. That's the first one, man.
Oh my goodness! Congratulations! Huge sign of relief.
South Juanita too. I mean, she's.
How you feeling? And I don't mean to just roll up on you, but I'm sure you want to share.
I appreciate it, man. I do. I mean, it's nice to just have somebody here. I truly appreciate it. You know, I'm happy, man. I was really nervous coming in here. I'm not gonna lie. I was super nervous.
So they said right off, what happened? You walked in.
They didn't even let me speak. They didn't even let me speak to the judge. I didn't even get to speak to her.
They just said this.
He just said your case is being dismissed, and I asked him what the condition was. He told me that there isn't any conditions at all. That to just show him this, it's like that.
Victory! Woo! Go on. Hit us with your best shot, right?
Yeah, so they said to just show him this if I go back, and I'm like, what? So I mean, I don't know if I feel comfortable going back. If I do, it's got to be with prejudice.
You're getting Alex ready
So
for this.
we'll see what happens, man.
What like was it like a process? Like, okay, so the application yesterday, that was their application to dismiss?
That was the legal team's application, the one yesterday, but the other one that I did my own
Okay,
application.
wait a minute. Tell them what was dismissed. You
So they just
opposing a live streamer being here.
yeah. So I did my own application for
That was a denial. Oh.
yeah, that was the denial because I did my own
Gotcha.
motion. I
So
tried
where
to
did
at
it
least.
wrong?
So
I
you
didn't
did
know
you
what
see
I was
how it
doing.
was up on the top where it said online
Yeah.
instead of down there?
But now I
how
know
you
why.
knew.
Yeah, so
Gotcha.
they ended up dismissing. I mean, they ended up denying mine. I put in for because the Dolly guy wanted to come stream.
Dally
I tried to
or
get them to
Dilly?
tell them no because I didn't respond in time.
Dolly or Dilly?
Dolly.
DALI?
He was supposed to be here today. I'm surprised he's not
Dolly?
here. He was supposed to be here the last
Is it
quarter.
Dally or Dolly?
I think it's Dolly. Is it Dolly or Dolly?
I don't know.
I thought it was
Dilly?
Dolly. I think it's Dolly.
So he filed a request
Dilly.
to film your case?
Yeah.
Dilly.
Yeah.
But
Dolly.
because Juice was moving,
And I
he
didn't
didn't
see
get that request because they sent it to his own residence instead of the new.
Yeah.
When he got it, he was past the objection phase.
So I put in for that and motion to dismiss, and they denied it.
But like I was saying to the viewers, so many people care about you and so many people know this is ridiculous. I said that just the fact that you have to come here multiple days, take time and resources,
I had to call
prepare,
in work.
preparation,
It's like
work,
sleeping
taking
on
off
the cement
work.
floor.
It's preposterous
Yeah.
that you had to even go through this grind on this.
He had to go through a lot of legwork. He
I
had to
didn't even
serve
want to
that.
miss
He
work
had to
today
serve
either. I
that.
love missing work, but today was not one.
Well, it's interesting they did dismiss it because the fact that they know it's BS. Like you said, how many times have they used statutes like that before
Right.
on anyone else?
No
Right.
one.
No.
But what happened is he did
Right.
win and serve the county with this motion that was naming all of them.
I'm gonna serve them some too.
Style of Juanita, where you're gonna get everybody on the damn list, and they went, oh. And then last night he received a letter saying, we changed our mind,
And it was last
but we
minute.
weren't sure.
Made him come all
But
the
they
way
said,
down here.
yeah,
You
they
could
said,
have called him.
they said we weren't sure.
Called me.
Thank God.
Interesting.
Thank
Interesting.
God.
So, what are we doing? What are we doing? Like, is every-
Alex is next. He's gonna
We're
get
going to
next
ball
week.
up, guys.
No,
we're going to ball up. I said,
Oh,
look,
I'm down.
look, hold on a second. Look how big I'm doing. He's taller than me, and I said he's going to guard me. I think I don't know. It's a challenge. I know you're tall and
Alex got
lanky.
some height on
I
him.
mean, I can play, but I don't know, man. I don't know.
You have to have, hey, I can
Juice is
step
gonna
up, but you have to help me down low.
You're the center, Alex.
I'm just saying, I saw his handles already.
Yeah, we're playing ball.
He does. I just need help down low.
We need to get Ted in here. Ted's coming back soon.
Yeah, for sure. I'm down.
Ted, he's coming back. Nick RPG said he'll play. Tucson said he'll
Coming
play.
down here.
Ted said it's Sunday.
Nice.
Ted said he'd come Sunday, so we have a
Alex on Monday.
well, we got a 3-on-3. We got Nick RPG. We got us. You got it's you, Nick RPG, and Tucson against me, Alex, and Ted.
You guys got the stamina in the tank? You
I
got
mean,
enough
Ted's
stamina?
pretty fast.
That's what I need to work on.
Ted jumps off buildings, jumps
Yeah, I'm
cones,
still, I got a little bit.
jumps
I
cones.
got to top draft at least until you start beating.
Yeah, yeah.
I mean, yeah. What's the chances of them refiling? I mean,
No, we can file paperwork and get that done. We're
I
gonna
don't
do
know. I
it.
feel like because you
We're
went
gonna
back
do
out
it.
there,
It's
that
very
they
helpful for the civil.
ended up bringing yours back up. What do you think? You don't think it was because
Mine's
you went
already
back out there?
No, because by then, no, that was even after. They dropped it, but then they just brought it back.
No,
what
but
I
they
would've
brought
happened
it back
regardless
as
if
a,
you
they
got
brought
it
it back as a misdemeanor.
Regardless.
Not a felony.
Is he allowed out?
Not a felony.
Yeah, but they blew it. Watch, wait till you see what I sent you.
Right.
Oh, and
I
then you
think
can
Juice,
adjust
though, is still
the,
working on trying to get it
All right.
with prejudice so that
Where's that at?
they can't refile
we'll
on
come down
them
to the sheriff's
again.
office.
Because this without prejudice is not good,
Yeah, I
because
I'll
then
go
it's
down to the
almost
sheriff's
like
office.
they're holding it over his head.
Where in the neighborhood?
Yeah,
I'll go
like
check it out.
I'm saying.
Yeah,
You
yeah.
can't be here, you can't be there, you can't be there. But that's all that P is.
Streamer strong.
Did you hear my theory, Alex?
Oh, you got my daughter plays last night, so she'll.
Oh, he thinks he's gonna work as a daughter, please. Don't work that way, buddy.
3 years of forward. Yeah, you let me know. I'm always down.
Yeah, don't work that way. If your daughter plays,
And
it's
the,
not
and the
gonna help
lights
your
on till
game.
9:30. Juanita wants to get up in there.
Hey, Alex.
You might have to take Chet's spot.
Yeah. Hey, Alex, I figured out what their new,
Jill, I got you, I got Nick.
I figured out what their new parking signs are. Have you seen that somebody's,
Yeah.
you know what they are? No P here, no P there, no P, because
Yeah.
it says no P. That's all it says.
It still has to be a metal
Did you
pole.
hear this guy's laughing at his signs? The printers?
Well,
Did
you're
you hear
next,
him
man.
laughing?
You're next.
Yeah.
They could always
You're
bring the
next, the
tea
24th.
bags that I had sent
24th.
Alex a while back that was on his Amazon wish
Now we know where
list.
the focus is shifting.
I don't know how
Daily
it
has
works.
court coming up.
Apparently you can pee in a bag.
Trial. 18?
This month?
Yep.
So,
Oh.
what's up with the DNA thing
You say the 13th?
that they put in
Wow.
for Luke?
Yeah, he was supposed to submit his DNA. I don't know. I
Nothing anymore.
Okay. Kids,
Well, I'm gonna
I
be
need to
there.
go back to work.
you going?
Yeah.
We'll go outside the courthouse for Luke Daly.
For sure.
So happy for you.
So what's the next plans, Juice?
You got something we're supposed
I
to
think we focus on the civil matter.
Civil matter. Oh, okay. Civil matter. So you plan to sue.
Oh, yeah.
Bye, kids. Bye, chat. Bye.
Bye-bye.
That is
God bless you. Take it. I'll see you tonight.
Gonna be at
Yeah, I'll be at the
Sheriff?
sheriff's office tonight.
that's where all my time is gonna go.
Okay, thank
So
you.
now-
We'll get it in the evening time.
Good, because I come out of.
I'll ask
I come
Nanos
out
for an
of the
interview.
base at about, I'm working over by the base, so I'm like high security right now.
Nice.
I'll be out at.
And I'm more
3
like
o'clock.
Juanita's
Okay.
height. So
See
you
you
and Juice and me and
All right, so
Juanita.
there
I don't think we
you're
do
playing in the
one-on-one
civil suit. So,
basketball,
okay.
though.
Yeah, that's what Tucson said he's
I could
doing
run
it.
between everybody's legs though, because I'm only 5 foot tall.
So now I gotta figure out who, a reliable, attorney that can do that.
We'll look around. We'll look around, find one. There is attorneys that take those type of cases. Don't know in the Arizona area how many, but each state has attorneys that take those civil rights violations, false arrest.
I don't know. I want it to be. I feel like when people sue, they ask for too much, and isn't that why people end up losing? When can you bargain when you sue somebody?
Well, the higher the dollar amount, the more discovery you can get. The lower the amount, you're more confined to limited discovery. So that's why people put just a high number, because the discovery for your case and Alex and Tucson would be interesting to see.
Yeah.
Just the orders, the calls, what got them to do that on top of the charge yourself. Why haven't they arrested anyone else for that ever? Charge anyone? The reports coming out that there was some, they were inside the Pima County Sheriff's Department, got orders from the top, just go and take the streamers out, target them like a target type of.
Which we have a lot of that. Well, not in the aspect of if they've ever charged anybody with that, but I mean, I think we got most of them. the nuisance part of the thing, I don't think we have any of that paperwork or nothing. So
Yeah, that's right. You got charged with 2 charges.
yeah, that nuisance, we don't have nothing. I asked for it. Told me because it was dismissed that I didn't need it, so I got to get it myself. But I think I've already put in for it, so we're just waiting for it.
So,
I mean,
folks,
we did it from the beginning.
there was no nuisance or any violation of public thoroughfare in Nancy Guthrie's neighborhood. Both charges of the juice got dropped. Both charges. There's no nuisance. There's no nuisance going on. What is nuisance to Nanos? Because someone doesn't like him exercising his First Amendment right, covering a public interest case, and that's
Right.
being a nuisance simply by holding a camera. Juice, as we've discussed, is we'll call you the most humble kindness of the group. You hardly raise your voice. You speak to your viewers. You ain't out there causing trouble. You ain't out there, causing a scene or going around knocking on doors or anything like that. So what is a nuisance by simply putting your chair in front of a case where it very most likely that she's still somewhere around there? What possibly?
And why did it take them so long to come up with that? Why weren't they charging us with that before?
Why wasn't the racks of
Media outlets.
tents and satellite trucks and cameras and cords and generators, why wasn't that a nuisance? But now it's a nuisance
Makes
for
no
one
sense.
person to sit
It
out.
makes no sense.
So they wanted to put their foot down. Why didn't they put their foot down at the beginning and get everyone out? Why did they allow for weeks? Is there a time limit to this? Is it saying you only can be a nuisance for 3 weeks, or you only can do this for 3 weeks and then it's technically a nuisance at that point? Or what do we got here?
And was it race or was it, or what?
I say
it
it
was
is.
something in the neighborhood.
And I don't necessarily out there, with my views, say things are the race card and everything like that. But in your case, I called it out. I said they targeted you because you're the color of your skin. I believe it. For you, because you're in the neighborhood. Oh, it's what? It intimidates a neighbor. Your presence in the neighborhood. Alex with tattoos. Does that intimidate presence in the neighborhood?
I have no idea.
I think it was racial profiling.
It's amazing because the majority of those calls didn't even come from people in the neighborhood. He told us that they did. But come to find out.
So where are you going now? How are
I
you?
don't know. I was probably just going to head home for a bit.
How are you getting home?
My girl should be here somewhere. I got a call.
Oh, she's here?
Yeah.
I would take you home if you
I
want.
don't know.
If she's not here, I'll take you home. You guys want to pile in the Jeep?
Let's see where she's at. Mark the Shark.
Where's Mark the Shark? He's here?
What's up, brother?
Oh, Mark the Shark.
He's on the line.
Man, congratulations.
Hey, man, I appreciate that, man. Thanks a lot.
How you feeling?
Feeling good, man. The only thing is the width. Yes, I will.
Go get some
I
burgers.
need it for work to show that I was here.
Okay, I will. Say it again, Mark.
Hey, I was in Clancy, but I freaking lost my keys in my truck, man. I'm so sorry.
Oh, man. You going to be able to get
Go
them
get
out?
some Whoppers.
I wasn't sure how many of you got to see that video. I didn't get to see it because it came on so early, so I had to watch it on replay. But I wanted to end the stream with something happy because the Clancy case is really hard. And the evidence is showing that she did do that to her children. And now they're trying to decide whether she did that to her children purposefully and mindfully, or if she had a psychotic break and had no control of her actions through the postpartum psychosis. It's such a hard topic to discuss, even though I know it's important. And like I was telling you in the beginning, I didn't want to do the case. I don't want to do any cases that involve children, but my niece convinced me that she would talk about the criminal aspects and I would talk about the medical aspects. And that's what we tried to do. So I hope you guys enjoyed that. And I wanted to end with Juice getting his charges dismissed and all of us being happy for that. And I'm pretty sure JLR said that he's going to be coming back on tonight, 9 Pacific time, which would be midnight Eastern time. And I think they're going to be outside the sheriff's office again. But does anyone have any questions or would like to come up and have a discussion about what our boys are going through or about the Clancy case, I'll put the link down one more time if no one wants to come up. My voice is just teetering on going on me, so I can play the rest of the video of Juice. You guys want to watch them go to Burger King? That was adorable. Let me see if I can fast forward that. And unless someone comes up, we'll end the stream.
Lunch on me. Let's
with the Burger King.
You want to?
That'd be cool.
All right.
It's so hard to say because that picture
But
is so
how about
picture.
this? How about this? If it's that day or it isn't, if we had the answer, what can we do with that information?
Good question. Yeah.
That's what I always think. In other words, let's just say, okay, we know for sure it's January 31st. It's the same night. Even if we all said that, we found out it was true.
I guess
What can we do with that?
nothing except for the fact that it proves that he was there prior to.
That's like people are like,
Actually.
we don't even know if she went over. Bro, we gotta have to believe something.
But see, here's the thing about it is if some sort of terrible accident came and stuff like that, why would the person prepare themselves to dress up in all this craziness with gloves and
It's a
everything like
costume,
that?
bro.
And man, yeah,
It's a
yeah,
heavy
that takes
costume, bro.
preparation to even
Very
dress
much.
like that.
But it's also someone who would know how facial recognition works because that costume,
Yeah.
they didn't
Oh,
care
for
about the
sure.
other cameras. They took 2 Nest cameras, but they didn't take the Casita camera. They didn't take any of the other ones. They didn't care.
But
because they
somebody
knew.
else brought it to my attention too, like the Nest camera. Doesn't Nancy Guthrie have images of that on her own phone
You would think.
through the Nest? Even
Yeah,
if you don't have a
regardless if you don't
subscription,
pay
it's,
for the-
yeah, you still
Yeah,
got it. So her phone's left behind. Why aren't there's nothing that appears on any camera footage on her phone?
Everything goes to the cloud.
Yeah. So I've had many. I mean, even
Nowadays, it's cheaper.
We've had so many discussions about
yeah,
this,
I've had a bunch of
guys.
little off-brand cameras
It's just
that
mind-boggling
still
that
at least like 6 hours.
2.5 months later, we still are
Even-
at
I mean,
square one.
I mean, there should be notifications that pop up on that phone.
We are 5.7 miles from Burger King, going for a lunch celebration. Juice got his charges dropped. Yay! Yay! Both charges. Nuisance. He's not a nuisance, and he didn't violate any
not a
public
nuisance.
thoroughfare.
What? 2 charges.
2 charges. Pull this out. Pull this one out.
I just wanted to see the Burger King scene because I love that Juice wears the crown the whole
I
time.
think so. Good. All right, hold on a second. I'm gonna plug this in the charger thing.
I just love these guys. And I am glad
Have
that
it
Juice got his
your
charges
way.
dropped. Now we just have to wait to see what they're going to do with Alex. And I hope they do the civil suit because the stress that Juice went through,
Have it your
I
way.
can't even
Go ahead,
imagine.
gentlemen.
He's such a sweet young
want?
man.
Lunch. Celebrate.
And it
Celebrate.
affected his family, and it might have affected his job. It definitely
Hi,
affected his
how are
health.
you?
We text back and forth every now and then, and you know, he's been pretty stressed the last month or so. It wasn't right what they did to him either. So I'd like a Whopper Junior, small onion rings, and a Coke, please. I guess we don't have to much ordering.
I'm not on the.
Said that we weren't recording. I
Yeah,
guess for the most part.
whatever. I'm not on record. I'm not on record.
Exactly.
Oh,
That's crazy.
because
That's crazy.
I didn't mean to say that. My apologies to anybody that I'm not offending.
Man, I started to bring my firearm, but I remember I Just remember, you guys can't be around it.
No, I just can't. No, I just can't be professional.
Oh, okay.
No, everybody else can.
I didn't want
You're gonna take it to court?
No.
Oh, I was
I
gonna
was gonna bring it with me.
you never know here.
Exactly. But I was like, no, let me not.
I think it's a nice side of town because the Coke because the Coke machine is open. You know what I mean? Yeah. Bro, I'm jail. I just made the whole day. Oh yeah.
This is the part I love.
Almost forgot to put my number up.
Those are our three
Chris
kings.
Cunningham sent me a message. No lettuce. Is there something going on with lettuce out there?
Yeah, no lettuce.
No lettuce. That's right.
Oh, someone put my number out.
There's poop in lettuce right now, so stay away from lettuce.
How can I help you? Hi, Todd. Ah. Right.
Oh, Bruce.
Oh. Tonight?
Sorry, Bruce.
Oh, hold on. Let me see, because I know. Well, we kind of. Oh, hold on. Let me put it on speaker.
Yeah.
This is Voices for the Missing.
Hey.
Hi, Voices for the Missing.
Hey, Judas. Hey,
Hey,
congratulations, man.
what's up, man? Thank you. I appreciate it.
Hey, I tried to reach out to you, man. So check your voicemail.
Okay, I was wondering. I'm like, I had some of these numbers I didn't recognize, so I was like,
Okay.
oh, okay, I see it. I see it. I should have known because it was a 520 number.
Yeah. Yeah, we're in Tucson too, so I just wanted to reach out to you guys. I wanted to invite you guys to a dinner. I don't know if I wanted to see if we could do it tonight, but Ann's telling me not tonight. So maybe we could. Okay. So what I would like to do is, when you guys are in town, you know, all together, I'd like to invite you all to a dinner one night, and we can kind of get together and talk.
Yeah, depending on what it is. No, I'm kidding. I'm kidding. No, hey, tonight I think we're going to the sheriff's station.
Yeah, we're going to the sheriff's station if you want to come down and say hi.
That'd be cool.
That was yesterday, yeah.
Well, I have to see what Ann's got something with River going on or something.
No pressure. No pressure.
Let me end this. All right, guys. I just love those three. I thought it would be a nice way to end our stream and see our guys, at least Juice, get his charges dropped. Alex next. Everybody fingers crossed. And that JLR is back in town. So I'm not going to sing because I can't. But in my head, I'm hearing the boys are back in town. The boys are back in town. So you guys have a wonderful day. I'll see you in the chats when JLR and maybe 857 go live tonight. Off Wednesday, so I may go live Thursday or Friday. And I love you all for being here. Thank you so much. Have a great weekend. Bye.
When I started down this road, I walked it on my own, looking for the answers hidden where the questions roam. But along the way I found a family I never knew, a community of truth seekers loyal through and through. Every comment, every chat, every kind and helping hand, every word of encouragement helped me take a stand. You've lifted me through doubts and days when things move slow, and I just want to thank you all for helping me grow. We're not just names upon a screen, we're more than what the world has seen. Together searching for the facts we know, questioning all leads and shutting out the noise. Don't see 303 is searching for the truth, shutting out the noise and following the clues. Side by side together through every twist and turn, sharing thoughts and lessons that we're all here to learn. Through the highs and the lows, wherever the evidence goes, the friendships that we've built are worth more than we'll ever know. Don't see 303 is searching for the truth, shutting out the noise. And I'm grateful for each and every one of you. In every live stream conversation, every late night thread, every theory carefully examined, every path we tread. Respectful disagreements, so open minds and honest views, trying to separate the facts from rumor, speculation, and conspiracy theory. The fellowship we built means more than words can say. A circle of support that grows stronger every day. Though we're miles apart, we gather every night, united by a common goal to bring the truth to light. We're not just names upon a screen, we're more than what the world has seen. Together searching for the facts we know, questioning all leads and shutting out the noise. Tom C303 is searching for the truth, shutting out the noise and following the clues. Side by side together through every twist and turn, sharing thoughts and lessons that we're all here to learn. Through the highs and lows, wherever the evidence goes, the friendships that we've built are worth more than we'll ever know. Tom C303 is searching for the truth, shutting out the noise, and I'm grateful for each and every one. Here's to our streamers, 85E7, Tucson, and JLR investigates. God, Juice and Alex, a criminal network helping navigate. Sleuth intuition and sweet dude, Chibi too. Patriot pride and exploring with Jim staying true. Savage CC investigates and PF 56. We investigates in cases and conversations in the mix. Nikki's unjust cases and Monk's intrigue along the way. Ted investigates and just Max live lighting up the day. Mark the Shark and DGL, Jim's survival stories we know so well. Dirty Diana, Bruce Davis, Captain Kevin standing by. Angel eyes to your corner reaching for the sky. Sikorsky 23, and let's talk with Chris. Brenda watching pretty little clues we don't want to miss. Every creator, every chatter, every friend I've come to know. You've helped build this community and helped this channel grow. Tom C303 is searching for the truth, shutting out the noise and following the clues. Together we're a family, connected far and wide, bound by friendship, fellowship, and standing side by side. The answers may be waiting somewhere down the road, but the people I've met along the way are the greatest treasure known. Tom C303 is searching for the truth, shutting out the noise with all of you. So here's my heartfelt thank you from the bottom of my soul, for every chat, every prayer, every kindness you've bestowed. We'll keep searching together wherever the evidence leads, because friendship is the greatest truth this journey's given me. Searching for the truth, shutting out the noise.